Hello, I'm Dr. Michelle Powell. I am also your Councilwoman for Residency 3, and welcome to our Wednesday 1 p.m. Healthy You. As you very well know, if you've been following us for this month of October, we have been talking about cancer in all forms, especially breast cancer. As myself, I'm a breast cancer survivor going on 3 years now in complete recovery, and the term they like to use is remission. In addition, we've also been talking about dementia and Alzheimer's disease. I'm going to do a little recap, and I did promise you to bring some show and tell items for our talk today, which will be some items on prevention of cancer, what I call early detection. Early detection is so important for two reasons. One, the sooner you identify cancer, the sooner you get to treat it and avoid the spread of the disease. In addition, it's cheaper, just as a side note. The more extensive disease spreads throughout the body, of course, there's more procedures, more hospital visits, more medication, and so it can become a very expensive thing to do. At the After I review all these items and things that I want to show you for show and tell for prevention, I have a wonderful guest that is with me today, a very good friend of mine, as you can see to my left. This is Miss Amy Taylor, who is a psychotherapist of over 25 years in Florida, and she has extensive experience with the topic of dementia and Alzheimer's disease, both in a professional setting as well as a personal setting, as she will tell you later her story, having cared for her mother of over 15 years with Alzheimer's disease. But let's get started first as a recap on cancer. The most common cancer, believe it or not, most people think it's breast cancer because so much attention has been given to breast cancer, and rightly so. With 1 in 8 women diagnosed with breast cancer, it deserves the hype. The big and good news is that the earlier detection for breast cancer, the more likely it can move to cure. So, the recommendation for breast cancer is that you get your first mammogram at the age of 40 if you do not have an indication for getting one earlier. What would an indication be? Well, what are you looking for? Do you feel a lump in your breast? Is there a nipple discharge? Is there a change in the color of your breast? Is there breast tenderness? Those are things which I would hope and I encourage you to run into your doctor to have an examination. And also, if you have a family member who had cancer very early, the recommendation is 10 years prior to the onset of the cancer, a first degree relative. For instance, if you had a mother who had breast cancer at 45, it would probably be recommended you get your screening started at age 35. But our number one coming at the top is lung cancer. Lung cancer is number one for men and women in the United States. And thank goodness we have clean air areas now where you're not smoking anywhere. Before, smoking was acceptable. You're eating food, someone would be smoking in the table next to you or even directly with you. And we know that secondhand smoke is just as bad as smoking yourself. So, what do you do? If you've been a smoker for over 15 years, it is recommended to do a low dose CT scan of your chest. If you're consuming over 1 pack of cigarette a day, it is time for you to get a scan of your chest to make sure that you have not developed a nodule on the lung. Okay, so that's really the screening for lung cancer. Of course, if you have productive sputum in the morning, you're coughing up blood, that's a not walk but run for these tests. The next most common, as we said, was breast cancer with the 1 in 8. And sadly enough, the majority of breast cancers that are diagnosed late and also have the most death is in African descent populations, unfortunately. They're not getting early detection. Our population is not getting treated early. And so we're seeing later stages and also death for things that probably, if diagnosed early, would have led to a more successful and survival rate. And the treatment, of course, is to get that mammogram at 40. And coming in later on, we're looking at the next, which is our colon cancer. Colon cancer is cancer where you have a mass growing in your colon. So starting at the age of 45, they moved it from 50, you'll be asked by a doctor to do a screening tool called a stool card. And pretty much what that means is you're going to take one of these kits home and you're going to have a bowel movement. And when you have that bowel movement, you're going to use a brush that's in the kit, touch the poop. So the first time you get to play the poop as an adult, and you're going to touch the poop, put it on the card for your first bowel movement. Discard this. Please don't put it in your toothbrush holder. And then the next time you have a bowel movement, you'll use another brush, put it in the second box, discard, again, not the toothbrush holder, and cover this, close it off, and send it to your doctor or bring it into your doctor's office. I personally ask people to bring it into my office because sometimes they mysteriously get lost in the mail. Not saying why, but bring it in and get tested. What are we looking for? We're looking for blood. You should not have blood in your stool, unless, of course, you have hemorrhoids or if you've had a very hard bowel movement from severe constipation. But again, we're looking for a change in bowels. We're not looking for, you're chronically constipated or you chronically have hemorrhoids. We're looking for you've had bowel movements every day. You get up, you have a bowel movement, no problem. And then for 2, 3, 4, 5 days, you can't have a bowel movement. You're having abdominal pain. It is time to get checked. Run for that check. And the final one that I want to share with you is what all women should be getting by the time they are 18 years of age. And it stops at age 74, which is a PAP. The PAP is a test for cervical cancer. And what's cervical cancer? We're looking at the cervix, which is the door to the uterus where a baby grows. This is a great test and it's an early detection tool. You go in and your doctor will use a brush like this to get tissue off the cervix and send it to the pathologist to see if there's any cancer in this area. And the great news about it, it's so simple and easy to treat if it's caught early before it spreads, and we don't want that to happen. We also have another cancer that can occur after menopause. If you haven't had a period in 10 years, 20 years, and all of a sudden you're bleeding, you really want to go and check to make sure you don't have a condition called endometrial cancer, which is the lining of the uterus. Okay, so those are the ones we've talked about. And of course, if you're like, oh my gosh, cancer scaring me, I have family members, I'm really concerned, then you can do a all-inclusive test. By the way, I have no association with this company. This is just one of many and examples I'm giving you that will allow you to do a full screening panel through a blood test for cancer. And you will have your blood drawn, just like you have it for any of the tests in your doctor's office. And they will send it to this company and they will screen you for cancer by blood. Isn't that cool? We've come such a long way. And I look forward to the time where we will go through a machine just like at the airport and we can do a full body scan and be able to screen for cancer and diagnose early. So that's my show and tell for our episode of Healthy You. Please do your screenings. But now I'd like to segue in. And Miss Amy Taylor, my good friend, thank you so much for coming today. Dementia is a tough subject. It's an emotional subject for many people. Can you just give me a bit background in your area and how you've dealt with individuals or even your own experience with the treatment with dementia or possibility of dementia or Alzheimer's?
Absolutely. The thing that I've said to you so many times is that what's called Alzheimer's is not necessarily Alzheimer's. When my mother was diagnosed, she was 72 years old when it began, when she started showing symptoms. It went for 15 years before she passed, and I cared for her. Well, I had her, actually, I didn't have her in my home caring for her. Many people make that assumption if I say I was caring for her. But I had her first in an ACL, an adult congregate living facility, and then when she broke her hip, a nursing home. And so it was a long haul, and I was with her, 3 to 5 times a week. And so I learned so much about it. But at this day and age, because of my age, I'm up there in my high 70s. Yay! And my friends are experiencing uh, loss of loss of diminished cognitive functioning.
Yes.
It's not diminished to the point where it would be considered Alzheimer's, but I always have to remind them, and I say this even though you are a doctor, but I know you agree. Many, many, many doctors, because they make their living
Yeah.
from treating illness, they are very quick
Yeah.
to diagnose something as dementia. Whereas when you get up in in the higher 70s, it's memory loss is very common.
Yeah.
Your brain cells have died. Many of your brain cells died. And if you're of my generation, you are the Woodstock generation. So many of your brain cells were killed off in the 70s anyway.
That's funny that you mentioned that. And we talked extensively, and I want to remind the audience that we talked about a number of things. Everyone wants to rush. They're starting to forget things, and they forget that what I called when the inn is full. The too much syndrome, where you're just doing too much and you start to forget things. But as you said, there are medications that can contribute to affecting your memory. There's also a certain, just even over the counter things like Benadryl.
Well, definitely. There's also the fact, like one friend of mine, always besides the drugs when he was younger, always had ADHD. Never really paid attention, and that becomes a way of life. And as you get older, you have to really become more mindful about what you're doing.
Wow.
You also have to consider diet,
Yes.
and I don't mean just diet of what you eat. I mean diet of what you let into your head, what thoughts you think, what kind of people you're around, and what about the factor of exercise versus a sedentary lifestyle. All of these things can keep what they call dementia at bay. Meditating, thinking positive thoughts, being mindful. If it's Alzheimer's, that's a different animal altogether.
Okay.
And even then, these things can prevent the exacerbation of it. And there's now so much going on medically to be able to test for Alzheimer's. Whereas when my mother had it, the only way to know for sure was a brain biopsy after they were dead.
Wow.
That was the only way to be sure it was Alzheimer's. Now there's so many ways to determine if it is, but too many things are called Alzheimer's or dementia that are not. But if you are dealing with your own diminishing function, that's really hard. And if you're dealing with a loved one,
Yes.
and watching them, and you see many of my friends from school, we just had our 60-year high school reunion, their spouses
Wow.
are already having severe dementia, many of them.
As a psychotherapist, how would you tell the audience who is working with, like you said, a spouse or a family member that is starting to show significant cognitive decline and actually has been given the diagnosis of Alzheimer's? What kind of impact that can they? How do they self-care for that? How do they take care and address that?
That's a tough question to give a carte blanche answer
yeah.
to, because it's different for everybody.
Great point. Yes.
But the most important thing is to start off by being aware of your own thinking processes, your own feelings of guilt, of fear of what might come, and to start realize. You see, with Alzheimer's, they say first the person dies mentally and then they die physically. But for me, like with my mother, I was just so glad she was there. I was so thrilled that I could go in and hug her.
Wow.
And when I would hug her, even though I was now the mother and she was the child, I could hug her and she would melt. And I was so glad she was still alive.
Wow.
And I was, excuse me, I was very fortunate. My mother never became ugly.
The combative part of Alzheimer's.
My mother got sweeter.
Wow. Wow. So that's a cognitive shift that, and we've seen, you're right. Many of my patients have complained that the personality shift is not towards the sweet, as you experienced,
Normally,
but really towards a very aggressive, combative behavior. And I shared a story of a husband whose wife actually was calling police on her husband, saying she has a stranger stealing things in her house.
That's the norm.
Yeah.
That is really the norm. Mine was the exception to the rule. We had other lovely things that happened that when I say lovely, I say that facetiously. They were hardly lovely. But what it is this: it's about acceptance. I'm not going to get religious on you because I'm not religious, but spiritual I am. And my
Sure.
spirituality is what kept me through it. Let me tell you something. The 23rd Psalm kept me going because, that as I walk through the valley of the shadow of death, which is life itself,
Yeah.
I shall fear no evil, for thou art with me. And that was it. I kept turning it over. And if you are from a spiritual background, you have a good portion of the battle won, because these are things you cannot control.
That's
You
the
can
point.
you can only control your way of looking at it. So you need to find the blessings, the lessons. Like I said, the blessing was she's still here.
Wow.
I can still hug her. As long as my mother is alive, I am still her daughter. And that gave me life. It wasn't, and I lost her when I was 50. And then I was thrown into adulthood. But it's really a very individualized thing. And the trouble is that in this day, as a psychotherapist, I say, in this day and age, there is so much of the victim mentality that people have. They feel like a victim. The world is a hard place to be. People are struggling on many levels, and they feel like a victim, and this compounds it. But the thing is this: when you're dealing with someone who's got Alzheimer's, you cannot think of yourself as a victim.
So I'll make a point on that. That's such an important concept, because not only a victim where she's doing this to me, she's not recognizing intentionality, showing intentionality for what's showing up with the person with Alzheimer's, that they're intentionally not recognizing the good I'm doing, or intentionally not listening to me.
Or even that. I remember with my mother when it first started, and we had touch tone phones back then. And my mom would call me and get my answering machine or voicemail and not understand what it was and go, Amy, Amy, and start hitting the buttons. And then I'd hear all that beep, 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 and then hang up and then call back again. This could happen 15 times in a row. And I did not know what it was. And I would yell at her and scream at her, because I would say, you're trying to drive me crazy. Well, what I learned is, again, you've got to do your research. You've got to become familiar with the various types of dementia and how they play out. And the victim is also, why is this happening to me?
Wow, the why
That's
me
what I mean.
syndrome.
That's what I mean is a victim more than anything. Why me? Why am I having to deal with this? We had so many plans. We were going to go to Italy. And now I can't do any of that. And, and you hear this and you think that, well, you can't allow yourself to. There's only one thing that you have control over, and that's your thoughts.
Your thoughts.
And it's your thoughts that determine everything else. I'm sure everyone hearing this has also heard your thoughts create. Well, whether you have or haven't, let me say it now, your thoughts create. And it's our responsibility to, if we want to change our lives, we have to change our thinking. Now, our life is what it is. If you have a loved one with Alzheimer's, this is your life.
But I don't want that life, Amy. I don't want to take care of my mom who used to take care of me.
Well, you do hear that.
Yeah, I do.
And as a therapist, it's like, well, what scares you? Why not? And getting a person to look at that. But the bottom line, the very unpleasant bottom line, is tough. This is
the tough love time.
This is your life. deal with it.
Wow.
I mean, I would not, there are some people I might even say that to. I'm very direct when it's appropriate.
Mm.
There's because you know, if a baby's having a temper tantrum, you don't usually, you might start off with, oh, come here, honey, I'm sorry. But there comes a point where you say, time out.
Stop that.
Right. Stop that, or it's time out. And, you know, even though we're adults, we still have temper tantrums.
Yes.
And this is one that's so understandable.
Yes.
You know, I mean, been there, done that. So I'm speaking from a place of complete compassion because I went through it all myself.
There's something that you said, that your mom was initially in an assisted living facility, and then went in after she broke her hip. She was then placed in a skilled nursing. And I know that there are many people who struggle with the guilt associated with having to make the decision to place their loved one into an environment that's not their home, or maybe not bringing them, if they were living independently, bringing them into their home and making a decision to put them in an assisted living. Could you speak to that guilt that's boils up in people?
It definitely does. But I can only at this point share my situation and what I did and hope that it will be helpful. In my mother's case, there was no choice because at the assisted living facility, they didn't take care of her, and it was on their time that she fell and broke her hip. So she had to go into a nursing home, and I had to liquidate her I had already liquidated everything. But what I did when she had to go into the nursing home, excuse me, what I did when she had to go into the ACLF, assisted living, it was called assisted congregate living back then. I took everything. I took her there to the dining room for dinner, and I didn't explain anything. And she ate there, and it was brand new, so it was beautiful. It was like a restaurant. And I took everything from her bedroom in her apartment, from the silk flowers to the pictures on the wall to the headboard, the whole shebang. And I had it transported to the ACLF, to her room.
Yes.
So when I took her upstairs from dinner, I took her up to the room that she had just left in her apartment. Well, she knew it wasn't her apartment, and she was infuriated and cursed me. And she didn't usually curse, but she cursed at me. Do you know, the next morning, she called me and she said, Amy, that was the best night's sleep I ever had.
Wow.
I love it. Thank you.
Wow.
And that was it. Yeah. So it depends on the situation. But if you figure out how to make it easier, because you really can't make it easier by explaining and all of that stuff.
The cognitive wherewithal to do that is no longer present.
You have to allow someone to learn experientially. So you look at it as a challenge of, how can I make this fun? You think in terms of when you're going to give a surprise party to somebody. You plan everything, and you do the same with this. You plan what you're going to bring. I made some mistakes. I brought her jewelry that disappeared right away. But anyhow, there's so much here. You know, your questions are wonderful. It helps me focus on what to say, because I've got this shotgun effect of all kinds of information. And the most important thing that I'm seeing is that so many people my age are having the memory loss, and it's being overdiagnosed. And that's what I really want to say. When my mother was diagnosed, they first diagnosed her with something called pseudo-dementia. And this is an important part that I want to make sure to bring up.
Pseudo-dementia.
Pseudo-dementia. That means it psychologically chosen or induced, because my mother basically just wanted to be loved and taken care of.
Wow.
And this was how she got it done. And she was happy as a clam, getting all the love and affection she could. Wow. And there are many people where life has just been too difficult,
And
and
already
they basically choose to
shut down,
shut down, go into they choose la la land,
cocooning, as they would say.
cocooning, and that's also that's where the psychological aspect comes in. And I had my mother seen by some really wonderful therapists. In fact, I had her seen, Brian Weiss, the big,
Yes, of course.
okay, I had her seen by the person that works with him, just to see what was really going on there. And she said, your mother just doesn't want to, she just wants to be taken care of.
Question for you. Do you think it's important if someone is concerned about having dementia or a family member is concerned about a family member having dementia? Do you think it's important to see a psychotherapist? Do you think it's important, or should they strictly just go down the avenue of medical management?
Oh no, I think it's really, I think uh, a psychotherapist who deals with senior issues and dementia.
Gotcha.
I think, because again, with my mother, if only for the reason that it gave me so much hope,
Mm,
because I thought maybe it's just pseudodementia and she'll never have those other aspects of
of
it.
dementia. Yes. Yeah.
But when my mother, who wore dentures, threw her dentures down the trash chute and then forgot what dentures were, I knew we were dealing with something a little more serious.
Yes.
And then when she forgot how to speak
Yes.
and only sang, but she sang wonderfully. If you spoke to her, she just did
Sing.
this and hummed to you. And there came a point where I had to say, she's happy. So that's the thing. I think
Happy.
that's the bottom line
Yes.
that I can wrap up with, is just focus on how can I bring this person happiness.
Wow. That's powerful.
And if you can just keep them happy,
Happy.
and then be happy because you're
Doing
doing
that.
that.
That's so powerful. Do things to make your family member or
Your love.
significant person happy, and gain happiness from the fact and the knowledge that you're making them happy
That you're doing
and you're
that.
doing something to contribute to their happiness. That is beautiful.
And then bless yourself.
Yeah.
And bless yourself.
Yeah. That's amazing.
Yeah.
Dementia is definitely something that's present, and it's a good idea to find out whether it's pseudodementia or the too much syndrome, or it's actually something significant like Alzheimer's or Parkinson's disease with dementia and so many other forms. But it's important, as you said, if you are that family member, that caretaker, find your happy space in knowing that you're contributing to the joy and happiness of the individual, your loved one, who is in this state. And I think that's with a lot of things too. And we'll do that in our next shows that we're going to talk about.
Absolutely.
And so I love the fact that we had this time. So please join me again for Healthy You coming in November. We are going to be addressing diabetes. Diabetes, I often say, it must be in the water because so many people have diabetes. So many people are in a stage called prediabetes. And so what I want to address in this time for the month of November is how to avoid it. If you do have it, how to control it. And finally, what many doctors don't talk about, how to get rid of it. It is possible. And we'll also be addressing the holiday blues and stresses because it's really important for us to address that this time coming up with so many holidays, there's a lot of stress, there's a lot of sadness, there's a lot of depression, and we hardly ever talk about it and enough about it. So I hope you'll be able to come back to talk with us on the subject of stress and depression. And I thank you for watching Healthy You. I hope it was very impactful, useful. If you took away a single pearl, like and share with someone else. Thank you.